Hello and welcome. Today, we're going to dive into a single symptom that can be pretty alarming. We're talking about blood in the urine. We're going to trace this one clue back to a whole bunch of surprisingly diverse and sometimes, frankly, strange conditions it can point to. Everything from super common infections to, well, parasitic invaders. So let's just put ourselves in this scenario for a second. Imagine you use the bathroom one day, you look down, and you see blood. I mean, that's an undeniably startling sight, right? It's often the very first signal that kicks off a whole medical investigation. So what does it actually mean?
Well, the official medical term for this is hematuria. You can think of it as your body's way of sending a very clear, if kind of unsettling, message that something needs a closer look. And it's not always dramatic either. Sometimes the blood is completely invisible unless you're looking under a microscope.
So let's use hematuria as our starting point. It's the crucial first clue in this medical mystery we're trying to solve. What could it be pointing to? Okay, so this is really important. There are two main types, and the difference is pretty critical. When you can actually see the blood, that's visible hematuria. Doctors investigate this right away because, as you can see, the risk of it being something serious is quite a bit higher. Now, non-visible hematuria, the kind they only find in a lab test, has a lower risk. But, and this is a big but, if it's persistent, especially if you're over 40, it's absolutely a signal that warrants a closer look. Now, while hematuria can sound really scary, a lot of the time it's linked to something much more common, a urinary tract infection, or what we all call a UTI. And I mean, they are incredibly common. Just get a load of this number. It's estimated that a full 50% of all women will have at least one UTI in their lifetime. That's just a staggering statistic, and it really shows you just how widespread this issue is. So how does this happen? Well, for the bacteria, it's basically a journey upward. They migrate up into the bladder, and then they stick to its inner lining. But here's the really clever and kind of frustrating part. They can actually invade the bladder's own cells and just go dormant. They form what are basically bacterial sleeper communities. And that is exactly why UTIs can be so maddeningly recurrent. These little guys are just lying in wait, ready to reactivate and start a whole new infection weeks or even months down the line. And this really shows you the constant battle that's going on inside your bladder. It's amazing, really. On one side, you have the bacteria's entire arsenal, tiny little hooks to latch on, and molecular shields to hide from your immune system. And on the other side, you've got your body's really clever defenses, the simple flushing action of urine, special antibacterial secretions, and even just the basic chemistry of your urine itself. It's a full-on microscopic war. But what happens when that microscopic war turns into a really long siege? Sometimes the problem isn't just a simple one-off infection. It's a chronic inflammatory condition, and that gets a lot more complex. And as you can see, the list of potential culprits here is incredibly diverse. I mean, it goes all the way from persistent infections like TB to the side effects of medical treatments, autoimmune diseases, and, as we're about to see, even recreational drug use. And this brings us to a very modern-day problem, ketamine cystitis. For a long time, ketamine was mainly used as an anesthetic, but its use as a party drug has uncovered a really dark side. It turns out long-term abuse can have absolutely devastating effects on the bladder. The risk is no joke. The research shows that up to 30%, that's nearly a third, of people who abuse ketamine over a long period will develop this severe inflammatory condition. And the severity is directly tied to how long the abuse goes on. The really crucial point here is the physical damage. Chronic inflammation literally causes the bladder to get scarred up and shrink dramatically. This can end up blocking the tubes coming down from the kidneys, which causes a dangerous backup of urine and swelling. That condition is called hydronephrosis, and if it's not dealt with, it can eventually lead to kidney failure. So the causes we've talked about so far have mostly been about inflammation and infection, but sometimes the problem is more physical, like bladder stones, or in some parts of the world, a parasitic invader. I know, it sounds like something straight out of a medical thriller, right? But for millions of people around the world, this is a real thing. There's a parasitic disease called schistosomiasis, and it's common in parts of Africa, the Middle East, and Asia. And its life cycle is, well, it's unique and pretty incredible, and it specifically targets the bladder. The way this parasite works is just extraordinary. It all starts in contaminated freshwater, where the parasite literally burrows through your skin. From there, it makes its way to the liver to grow up. Then, the adult worms travel to the veins around the bladder and lay their eggs. And here's the wild part. To keep their life cycle going, those eggs have to push their way through the bladder wall so they can get out in the urine. So, how do doctors even spot this kind of invader? Well, the symptoms often include that painless hematuria we've been talking about, but the real telltale signs are found during an investigation. A look inside the bladder reveals these classic sandy patches, which are actually caused by old calcified eggs. And then under the microscope, the eggs themselves are totally unmistakable. They have this characteristic little spine on the end.
Okay, so with this huge range of possible causes, from bacteria and parasites to drugs and stones, how in the world do doctors figure out what's really going on? And that brings us to our final section, the diagnostic toolkit.
Really, it's a process of elimination, using a whole combination of tools. It usually starts with simple urine tests to check for an infection. Next up is often a cystoscopy, where they use a tiny camera to get a direct look inside the bladder. Then you have advanced imaging, like a CT scan, which gives a super detailed map of the entire urinary system. And finally, if needed, a biopsy. Taking a tiny piece of tissue can give the definitive answer right down at the cellular level. This quote from our source material really just sums up the goals of treatment perfectly. Number 1, and this is the big one, rule out cancer. Number 2, protect the kidneys and make sure the whole system is working like it's supposed to. And finally, and this is just as important, improve the patient's symptoms and their overall quality of life. So we'll end with this thought. Whether it's a simple UTI or something way more complicated, symptoms are your body's way of talking to you. The key thing to take away from all this is that these signals, especially one as loud and clear as blood in the urine, should never, ever be ignored. Listening to your body is always the first and most important step in taking charge of your health. Thanks for joining me.